HIV is a viral infection. It stands for Human Immunodeficiency Virus. Luckily in this country we have drugs that can stop the HIV virus from developing into full-blown AIDS. AIDS affects your immune system, so that means it brings your immune system down so that if you even get a small infection, it can kill you. HIV is transmitted through bodily fluids. There are only 4 through which HIV can be transmitted. That's semen, vaginal fluids, blood and breast milk. There are small traces in saliva and sweat, but it's very unlikely that you're going to pick it up through transfer of those bodily fluids. The most common route to pick up HIV is through unprotected vaginal or anal intercourse. You could also pick it up through oral sex, but that's very, very unlikely. That's a low risk. The other routes are through the sharing of used or dirty needles, or through needle stick injuries, or there is mother-to-child transmission. This can happen where there's an HIV positive woman who is pregnant. She can transmit the HIV virus to her child during pregnancy, birth or through breast milk. In this country, every pregnant woman is tested to see whether she is HIV positive. If she is HIV positive, in the later stage of pregnancy, we can give her drugs which actually reduce the risk of her transmitting HIV to her baby. In order to prevent yourself from picking up HIV, you need to always use condoms when you're having penetrative sexual intercourse, and to make sure that if you're an intravenous drugs user that you don't share needles. So if you think you've put yourself at risk of contracting HIV, you need to go and get a test. You can get a test from your GP, but you will be charged for this if you don't have a medical card. But you can get a full, free and confidential STI screening from your local STI clinic. And to see which one is the nearest one to you, look at our APPS map. And if you want to know more details about STI tests and what it involves, look at the video on STI tests. If you think you've put yourself at high risk of picking up the HIV virus, you can get an emergency treatment which is called PEP, which stands for Post-Exposure Prophylaxis. This involves a 4-week treatment which may reduce the risk of HIV becoming established, but you have to take it within 72 hours of the incident. It is only available in A&E departments and in some clinics. In Ireland at the moment, there are over 6,000 people who are living with HIV, and every day, almost one person every day is newly diagnosed with HIV, and this figure could be a lot higher through non-testing. So the thing is to go and get yourself tested if you think you're at risk of picking up HIV. If you have been diagnosed with HIV, don't panic. All the treatment that you need is free in this country, and there are support services available to you which you can see the closest one to you on our app map.